Welcome back. As South Africa's vaccination drive pushes forward, undocumented African migrants are worried that their details will be shared with immigration authorities. The Dennis Hurley Centre in Durban chosen to pilot a project with the health department to vaccinate migrants insists this is not the case, though. For more details, I'm joined by the centre's Raymond Perrier. Thanks for your time, sir. Appreciate it. So this, of course, is a concern, right? There are many people who don't want to get vaccinated because they are afraid this is going to happen. How do we ensure it doesn't?
So the Department of Health recognises that a vaccination programme needs to embrace everybody, and having documents or not having documents shouldn't be a block. So they've come up with a system which enables them to log the information about somebody, simply their name and their date of birth, as a way of tracking the vaccine. But that information is closed within the Department of Health system, cannot be shared with other government departments, and in fact contains very little information about the individual. And what we found is that this is sufficient reassurance to foreign nationals who are in the country who don't have documents to come forwards and start looking for vaccination.
Of course, it has been a huge deterrent. What happens when some people say to you, we don't even have passports because we've lost them? How would it work in that instance?
Exactly. So you need absolutely no document to take advantage of this system. You simply come along and give your name and your date of birth. The system has been set up by the Department of Health, not just for undocumented foreign nationals, but for many homeless people who are living on the streets, who are South Africans, but don't have IDs. They've also missed out on vaccines up to now. And because they're working with an organisation like the Dennis Hurley Centre, which already works with homeless people and with foreign nationals and has built trust with them, then we have a relationship with these communities, which means that they will come forwards and they will seek vaccines.
Yeah. And then just in terms of getting people to come to you and say, help us with this, how do you get this message out there?
Well, as I say, we're already working with those two communities, homeless people and foreign nationals. We're already providing primary health care to them day in and day out. We've got connections through the churches in central Durban, through the other religious organizations, and a number of the pastors and priests are working with us to mobilize people, to motivate them to come and be vaccinated. So it only works as a collaboration between the different sectors. We couldn't do it without the Department of Health, but to be fair, the Department of Health needs organizations like ours that have the links with the communities and has the trust of the communities. And that's something they've understood, and that's why they're working with us.
Yeah, the reason I asked is because, you know, there's lots of discussions about people who are from other countries working in South Africa who are in particular domestic workers, and they say, you know, they're afraid of going. So how do you reach out to them? Would you say to the general public, people even watching this who have, you know, helpers who are from other countries working for them, to reach out to you and say, we need assistance or our helper needs assistance?
Absolutely. Since we started at the beginning of last week, my phone has been ringing with people saying, I have a Malawian gardener, can he come along? Of course, anyone can come along and be vaccinated at the Dennis Hurley Centre, whether or not they have documents, whether they're South African or foreign nationals. Once we've perfected this pilot, then they will be setting up, the Department of Health will be setting up other locations in the cities and in some rural areas where there are large communities of undocumented people to make sure that they also have access to the vaccine.